Welcome back to the Liberating Generations podcast. I am Dr. Keesha Ewers, and my beautiful co-host, Regan Claire, is joining me from the Bay Area in her apartment from grad school. Hi, Regan.
Hi, Mom.
So we're talking a little bit about, we're going to harvest what you're going through right now for this podcast.
Okay.
We're talking a little bit about the impact of trauma on the physical body. And this goes beyond the biology of trauma. Everyone wants to kind of hang out with the biology of trauma, about the brain and the limbic system. And this is not what the full picture is. Actually, the mind and the habits of mind are what tell the brain that you're not safe or you're not okay, and then send messages to the rest of the body for how to react, how to respond, right? Okay, react, actually. So you're going through a little reaction process right now.
Yes.
A little anxiety. Yeah.
Yeah.
So one of the things that we talk about on this podcast is how it is the human experience to move from innocence at birth to wisdom at death. And that the pathway from innocence to wisdom is through heartbreak, betrayal, and trauma. And that is what manufactures what we create our false self from. Like, okay, that hurt that we just experienced when we were, in different developmental stages, like friends turning on us and rejecting us, right? Betrayal and trauma. Then our undeveloped mind, right, that hasn't learned skillful ways of processing heartbreak, betrayal, and trauma, because how could it as a child, right? And a brain that is not fully developed yet. There's meaning that gets attached to whatever the experience is, and then a strategy that gets created. I call it the adaptive behavior response. So that adaptive behavior response can come in a number of different ways. So you have a group of friends that turns on you, which you had. And what was the meaning you created about that?
That I'm a bad person,
Not
not
good,
lovable.
not lovable. And what was the adaptive behavior you began to use to combat that?
Being super nice and easy to get along with.
How could you possibly not like me? Yeah, using kindness.
Using kindness as a manipulation.
So that then in adulthood becomes maladaptive. So when the button gets pushed, like somebody isn't liking me, then your 13-year-old self will show up. Oh no. Right. Now, what we're going to do is we're going to tag that. Oh no. And what happens is, right, that's the mental habit of rejection equals I'm not safe. I'm not going to get the love that I want. I'm not going to be included in the tribe. And we know that if we're excluded from the tribe, pushed outside of the community, outside the firelight circle, saber-toothed tiger can eat us. So that's not okay, right? And so that then the brain will kick in now and alert the adrenal glands to release cortisol, because now we're not safe, right? Cortisol that keeps getting released in that way will begin to break down the gut wall. The brain will begin, if this goes on and, for a long term and not just a very short term, like a lion chasing a zebra and it takes the zebra down and now the lion pride has something to eat for a week. If it keeps going, right, you get digestive issues because the digestive system shuts down. The zebra knows it's not safe to reproduce right now. So your hormones that would ordinarily go toward feeling good in your skin, having your brain function, your cognitive function be expansive, will narrow and focus. So now you're focused on the survival and perseverating about this one thing. Everything collapses into this one thing. Is it sounding familiar?
Mhm.
Yeah. And so now you can't take in other information. You're just going around and around and around
Mhm.
in this ruminating thought loop, which then your body will have to start stealing progesterone to make cortisol.
Mhm.
And now your liver isn't detoxing very well because digestion is shutting down. So the byproducts, and I want to really emphasize this, they're called metabolites. The byproducts of the hormones that you already innately have can't get moved out of your body when you're done using them.
Mhm.
These are what cause cancer in men and women. And it affects the ratios of your hormone levels themselves. A lot
Mhm.
of times when we talk about hormones, people just think about estrogen, progesterone, and testosterone. So in your body right now, if you're feeling anxious, cortisol is the wheel, the machine for manufacturing it is turning and it's grabbing progesterone, which leaves you estrogen dominant. So estrogen is, it's a great hormone. We need it. Women need it.
Mhm.
But if you can't get rid of the byproducts from it, then it can cause big trouble, cancer, autoimmune disease. So are you the only one that's stressed in the world? No. Right. And so as we talk about this, we're talking about this because we want our audience to understand
Mhm.
for every 5 minutes you're upset, it takes your body 8 hours to get back to homeostasis,
Mm.
your digestion to come back, right? Your heart rate and your blood pressure to come back.
Mm.
Stop holding yourself in tension, your gut to relax. That's only if you're upset for 5 minutes. It's an
Yeah.
8 hour recovery process. If you're
Yeah.
upset for days at a time, think of it, right? So this is why I always say trauma is the missing piece of the cancer puzzle, the autoimmune puzzle, the addiction puzzle, because is that anxiety that you feel inside of there, does that feel good?
Right.
So then what is the purpose of alcohol, sugar, shopping, sex, gambling, right? All the
Mhm.
addictions that we can have is to try and alleviate that felt sense of anxiety. That's something that we'd like to have control over. We don't have control over and we don't like it. So, there's like a two-prong answer to this. We're not just presenting the problem,
Mhm.
and we have a couple of answers. One is I always think about it like checking the oil in your car, like the dipstick. You want to see what your oil levels are before your engine burns out. And so doing hormone and adrenal testing, but making sure it's not blood work testing where only the levels are checked. We want to know what the byproducts are. It's actually it's equally as important, if not more important.
Mhm.
So that's really, really essential that you do that. If I always say, if you're in a stressful life situation, do it every 6 months. If you are a cycling woman who keeps having to shift and change her hormone levels to treat whatever's going on every 6 months. If you're someone where it's been stable for a long time, then every year. I do it every 6 months.
Mhm.
Yeah, you do it every 6 months.
Mhm.
So that's one thing, is just checking in on what's the biological downstream effect of the mental habit of mind from past trauma. We
Mhm.
want to check in on that part. Okay. But that's not the end of the story. The second part then is, who is it that needs to have some wisdom imparted to her right now? Your 13-year-old, right?
Yeah.
So it's like your 13-year-old is at grad school right now without any skills to manage it.
Yeah, there's definitely some imprinted neurological stuff that's coming up for sure. Yeah.
So what is it that we have a another people being heard from over here. But say more about those neurological imprints while I mute myself, okay?
Um, well, anytime we have anxiety that comes up, so I know this consciously, uh, it's just a kind of a blueprint that's already taken place from my past experiences. So if I feel into the anxiety that I'm experiencing right now, I can reflect back to 13 years old when, when my friends kind of turned their backs on me and shoved me outside of the circle. And the neurological blueprint was that I wasn't safe, that I couldn't trust my community to like accept me for who I am. And yeah, that's definitely coming up right now in my in my circle at school. But it's kind of like a self-fulfilling prophecy when and so I'm aware of that. Like I can see the thought and I have the tools now to take the 13-year-old by the hand and let her know that that's not what the experience is. It doesn't help that I've had that experience again here at grad school before. Um, but it was a self-fulfilling prophecy that made that happen. So, yeah, just trusting that this is not that. And I mean, the anxiety that's happening right now is the desire to control another person's experience. Really, that's where the anxiety is coming from. And so it's just trusting that, I mean, yeah, it's going to work out how it's going to work out. And it's not my responsibility to control someone else's feelings.
And part of the human design that you have, so for those of you that haven't heard of human design, this is a really lovely model for bringing in the I Ching and genetics and astrology and 88 days before you were born, your unconscious motivations and life purpose, all of that. And you have a profile, half of it is like mine, which is that you actually learn in life through the making and breaking of bonds.
Mhm.
So if you can recognize like that's a sort of higher ordered purpose
Mhm.
and let your 13-year-old self know that, yeah, like all all that we experience in life is impermanent. Every bit of it. Nothing's permanent. And so that truth, that capital T truth, we can capital T trust in
Mhm.
that everything is impermanent. And then rather than trying to control the outcome of making something that's naturally impermanent permanent, which is going to
Mhm.
cause suffering, uh, staying in your own lane, and being your highest and best version of you with integrity and loyalty and kindness and compassion
Mhm.
and insight, into what makes you tick, then that's the only thing you can control, right? And then if you have grief about the making and breaking of another bond in life, which is very hard. I've had two patients in the last, no, three patients in the last 3 days share with me about the loss of their beloved dogs in the last,
Mhm.
like just been losing dogs in my patient population.
Mhm.
Of course, you and I know like how devastating
Mhm.
a loss of a close relationship and bond is. All of us do. That's part of, like I said, life on
Mhm.
planet Earth. And so it's going back and giving that wisdom teaching to the 13-year-old. Like, you're not
Mhm.
doing anything wrong. Sometimes people are unskillful. They don't talk
Mhm.
about places where they get hurt. And so then
Mhm.
they just shove you away instead of inviting you to a conversation. That
Mhm.
takes a lot of very higher ordered reasoning and complex thinking capabilities that 13-year-olds don't have yet,
Right.
right? And so it's reassuring her with that wisdom you have now that you're committed to always making sure that you invite people to conversations where
Mhm.
they're, because you're of course going to be the cause of hurt and pain for other people, But if you're committed to communicating and inviting communication around that and committed to repairing if it's possible, right?
Mhm.
That's the learning. That's the wisdom that comes from the compassion that emerges from that pain of the loss of significant others in our lives, right?
Mhm.
Yeah. So it's bringing that 13-year-old into your heart and cuddling her and saying, "You're never going to lose me.
Mhm.
I'm never putting you outside the firelight circle. I see you. I appreciate you. I'm thankful for you. And I see the light that you are, you know?"
Mhm.
Yeah.
Mm.
How does that feel?
Yeah,
Yeah.
feels good. Yeah, it's leading into the disowned parts.
What is it that you're seeing as a disowned part here?
The temptress.
Mm.
Yeah. She's a disowned part for sure.
Seducing people into liking you and then having the repercussions of when it crosses over a line of just liking into infatuation and you having to have a boundary or clean up a mess from that,
Mhm.
right?
Yeah, and trying to figure out where's the line of, is this a conversation that needs to take place or am I just imagining it?
Mhm. My experience is direct talking works.
Yeah.
Speak directly into it, you know?
Mhm.
I had an experience one time with this and said, "Are you sexually attracted to me?" You know, just like asked so that
Mhm.
there wasn't this like underlying blah, 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 blah. And it took him by surprise, and
Mhm.
we were both married and friends. And I just said, I want to make sure that we can move past that and keep good boundaries. Right. And that actually was such a good um practice in that moment for all the parts of me that would worry and not say anything. And it was such a relief for him too. He's like, "Oh, okay." Right?
Yeah,
Yes,
address
I can
address
move
the
past.
elephant in the room.
Yes, exactly.
I think there's also some frustration that comes up around, like, the whole idea that men and women can't be friends and wanting to beat those odds. Yeah.
Different.
Yeah. Yeah, exactly.
Yeah. I mean, I think they can as long as there's really good, clear communication.
Yeah.
I think that's the key. I always talk about this too, like scrape you off the ceiling. Sex comes from scrape you off the ceiling communication.
Mm,
So really, really good friendships are going to come from really, really, really good communication, right?
yeah,
The
it's true.
willingness to be vulnerable, the willingness to self-reveal,
Yes.
right?
Mhm.
Call out whatever is being felt or seen and, move through it.
Mhm. Yeah. Alright. There are some hard conversations that need to take place.
Yeah.
Yeah.
This is adulting.
Yeah. It's so fun.
But notice like if you think about the level of anxiety you had when we first started talking, and then if you can comfort that 13-year-old, give her like say, "You're not the one that has to do that. You don't
Yeah.
have to have this conversation. I've got it."
Yeah.
Right.
Mhm.
And you don't have to control what the outcome is on that either. If somebody
Mhm.
says, "I can't be around you because I'm in love with you," then that has to be like
Mhm.
sadness and the grief that you feel is yours to feel. You can't control that, right?
Mhm.
Yeah. So the willingness to let people have their experiences without us managing them
Yeah.
because we're afraid of losing them.
Right.
So manipulative.
Yep.
Yeah, I don't want to lose you, therefore I'm going to dance around, a million
Yeah.
ways, which makes a mess out of everything.
Mhm.
Yeah, it's walking on eggshells and you get hurt feet doing that, right?
Yeah. Yeah. You're so right.
And you've had this experience before, and so you get a chance to do it in a different way
Yeah, it's true.
and feeling like you can trust that the other parties are good for it. And if they're not, then it was going to fall apart anyway. And then your little adrenals can relax,
Yeah,
right? Because your mind isn't saying anymore, I'm doing something wrong, I'm unworthy, I can't, right?
yeah.
Um, yeah.
I think I'll just send my friend this podcast.
I was talking about EU.
Hi. We can just use their name as the title of this podcast episode. I'm just
Dear. So, so you've been working with people in grad school
Mhm,
as a health coach who
mhm,
are also in various dilemmas of different flavors. Like we're talking
mhm,
about one flavor of a dilemma. There's so many more, right? And so our adrenals, get wiped out. Then we start stealing those sex hormones.
mhm,
Progesterone starts going into deficiency, and estrogen goes into dominance. And remember, the next part of that is, and the liver oftentimes can't get rid of the leftover metabolites, the byproducts that cause autoimmunity and cancers, prostate cancer,
mhm,
uterine cancer, cervical cancer, breast cancer, all kinds of
mhm.
cancer, as well as brain fog, mood issues, sleeplessness at night, weight problems, all of it, skin issues, inflammation,
Yeah.
dysbiosis in the gut. So you work with people as a health coach in this way. How can people reach you to do this testing?
You can reach me at Regan Claire at tasteofliberation.com. It's ReganClaire at tasteofliberation.com. And then you can also reach out to me on Instagram, direct message, which is Taste of Liberation.
Nice.
Yeah.
And then we're doing something new in my practice where we're doing this testing and then doing group coaching with it, where I'm going to teach everybody who buys the test. And we've partnered with a lab that's offering it at like half of what it. We did a survey to our list, and people came back and said they had three concerns.
Mhm.
One of them was detoxification and how to do it in an individualized way for them.
Mm.
That one was they were, obviously I talk a lot about autoimmunity. They wanted to know how to reverse their autoimmune disease. And
Mhm.
the third one was cost effectiveness, right?
Mhm.
That could be a big barrier. And so we combine those three by saying, okay, we're going to do hormone metabolite testing then, because that's one of the primary root causes. It's connected to trauma, it's connected to genetics, it's connected to your gut. And then for cost effectiveness, I'm going to gather everybody together on a Zoom call, record it, and teach you how to look at your test results, give what you
Mhm.
do for each thing. And so it's like teaching a man to fish instead of giving him fish. So you've
Mhm.
got a couple of different options. You can work one-to-one with Regan, who's just amazing.
Right back at you.
And then if you're interested in learning how to do this for yourself, you can join the Academy for Integrative Medicine Health Coach Certification Program.
Mm.
And I did a Q&A on that last night. And you can reach out to us at info@drkeesha.com, or you can just join a class to
Mhm.
learn how to do this one test, look at your results, and move from there.
Mm.
So got all kinds of options. It's important to one of the things that gets those adrenals going is being angry at the medical model, being angry at the government,
Mhm.
being angry about people that are vaccinating or not vaccinating, masking or not masking, being angry in
Mhm.
general, right?
Right.
Being worried and anxious, like all these things create that for every 5 minutes you're upset, it takes your body 8 hours to recover.
Mhm.
And therefore, it's not about some magic pill or supplement that's going to solve everything. It's
Mhm.
really taking this in the whole picture. So these are some ways that you can approach that.
Yes.
Beautiful.
Yes. Thank you for sharing that, Mom.
Yeah. And thanks for
Mhm.
sharing your experience in the moment.
Yeah. Yeah. It's important.
Mhm. And you have so much community that loves you.
Mm. Yes.
Yeah,
Yes. I know I'm very supported and held, and
mm,
I've also got me.
that's
So,
right. That's exactly
mhm,
right.
mhm.
All right, everybody, make sure that you say that to yourselves, to all the little parts that are you. All of them are available in there from the time that you were conceived to the moment you are right now. All of those parts are in you. Make sure they know that you have them. I've got you. I've got you. And you're not expecting anyone or anything outside of you to have you,
Yeah.
right? That's your job. Locus of
Mm.
control, internal. All right.
Mm.
Until next time, be well.